Dr. Cassie from NABC's VetFolio and the host of Vet2Vet. Pet parents seeking care for their animals have one thing in common. They care about their pet. But that doesn't always mean the gold standard of care, what many of us have been taught to offer first, is the best option for them. Joining us is Dr. Emily Tincher. She's the Senior Director of Veterinary Relations at Nationwide Pet Insurance. Dr. Tincher, thank you so much for being here.
Thanks for having me. It's great to be here.
We're happy to have you here. Let's go ahead and dive right in. The price of everything seems to be rising these days, and I'm sure that's true of veterinary care as well. What does the current data say about the cost of veterinary care?
Yeah, it really depends on where you look, but no matter where that is, we can see that, as you mentioned, everyone is experiencing inflation right now at roughly 7% at the end of 2022. And what we see in pricing in veterinary medicine is that it's higher than that. It's outpacing inflation, roughly 11% at the end of the year.
Goodness, 11%. I mean, 7% seems like a large number. And so to know that the average prices in our industry have increased an additional 4%, I feel like that's a really eye-opening fact. What do you think is driving the increase in prices?
Well, we know it's happening for a number of reasons. Certainly, supply and demand in our workforce is a challenge that we're managing across the veterinary profession. So not only are pet families paying more because our prices have gone up in a hospital setting, but we also see that in many cases they're paying more because the level of care that we're providing is higher than it's ever been.
It seems almost like it could be a little bit of a double-edged sword there.
It's a compounding factor, and we completed some research at Nationwide a couple of years ago in 2018 that investigated, what is it that pet families are looking for and how can we provide more care to more pets. When one of the top pain points that we saw when we talked to pet families was that the gold standard of care that we learn in veterinary school and that we provide in many cases and recommend strongly in vet practices clashes with what pet owners are looking for. Going back to our challenges around pricing and our challenges around providing the care that people are looking for, we know that it's not an option for everyone.
Sure.
Just think about the financial pieces. The fact that about 1 in 3 people that are trying to access veterinary care do experience some amount of barrier, and most of the time that's a financial one when they're coming and talking to us. So really at Nationwide, we've been trying to say how can we have better conversations in the veterinary space?
Sure, bringing it back a little bit to some of that communication.
Certainly communication and really the concept of providing a spectrum of care. Saying how can we meet pet families where they are by combining evidence-based medicine, pet family-centered communications, removing judgment from the communications that we have, and saying let's provide a range of pet care options from basic to advanced that really meet you where you're at.
Gosh, so much I want to dive into there. I'm thinking removing judgment from our conversation with pet owners and allowing them to pick different options for what suits their situation, but also not judging amongst ourselves as veterinarians for offering maybe a lesser treatment plan because that was the right situation for that family in the moment.
There's a lot to unpack there from what is best. I think we are really trying to think differently around, and us and in collaboration with others in the industry. We didn't invent spectrum of care. It's a documented term that in peer-reviewed publications, a couple of papers in JAVMA that have really been formative in helping us and others across the industry to feel like we're having unified conversation about really practicing in a way that my parents, as second-generation veterinarian, my parents who practiced in rural Kentucky, the way that I saw them practice growing up. And so that communicating and having the basic skills of how do I understand and learn about what your pet, what a pet family in front of me's challenges are certainly a big component to that. The other piece of it that we really are trying to bring in, and again is a key component of spectrum of care, is marrying that with the evidence-based medicine component. So coming back to your comment about a lesser amount of care, really even the language that we use around levels of care can feel judgmental and reinforce that component.
For a word there. I was like, I don't know what I call it, but you're right. It does feel that way.
Yeah, I really love, as we were talking through this, it's been a challenge and a bit of a flip in perception for our teams internally at Nationwide too. One of our team members came up with the phrase, basic isn't bad. And so whenever I'm trying to think my way through, how do we talk about care and understand that, a pet family that is maybe choosing I saw a puppy with parvo recently on an ER shift. If someone is choosing a more basic option than hospitalization, not only can I talk to them about, okay, I understand that the advanced level option might be hospitalization in that case, but this particular pet family, the gentleman seeing me had already said that he was on a fixed income and that he wanted to do absolutely everything that he could for his puppy. He was a huge part of his life. But that he didn't, he gave us a budget from the very beginning of, I have this amount to spend today, and that amount to spend today was not going to get us to a conversation around hospitalization. Well, the great thing is we know we have some additional evidence base that we can lean upon to have a good conversation with families like that. Specifically for parvo, we have the Colorado State Protocol that we know is 8 and 10 puppies have a great outcome for with that outpatient management versus hospitalization. 9 and 10 puppies have that great outcome. The cost difference is significant.
That's substantial.
Substantial. This particular gentleman, he wasn't able to necessarily do the complete Colorado State Protocol either, so we modified that a little bit for, I would say, the most basic option available. But with a puppy still barking at me in the room, bouncing around, I felt really great about providing that option, knowing it's leaning on some evidence-based medicine and meeting him where he's at. What I found really interesting about that particular case and why it stuck with me is I came back into the treatment area from talking to that family, and one of the staff members asked me, are we euthanizing the puppy? I said, no, he's still barking in the room. He's still barking in the room, and we're going to try some outpatient management. We have some education that we're going to send home with him, and a backup plan in case the puppy's not doing well. And she said, I've never seen anything besides hospitalization or euthanasia. And so just providing education on the evidence base that we have for this range of options, especially in circumstances like parvo where we do have great evidence, is part of what we're doing nationwide.
It's such an impactful story of that's a perfect example of everything we're talking about here.
Yeah, absolutely.
Well, let's pivot back to pricing just a little bit, thinking about being overbooked and having busy schedules. And I feel like when I'm following or a part of discussions about being overbooked, not being able to keep up, there is this advice to raise prices, which makes sense. What kind of effect, though, is that having on our patients?
Yeah, we've heard about and seen in some of our data and those of our partners of prices being increased even as high as 30% in some practices over the last year or two, which sometimes we have to raise prices. That's just part of it, and it's a challenging conversation to have around how do we pay our staff a living wage, and how do we try and attract and retain great staff members when we know we have some challenges with our workforce right now. One of the things that we're talking about actually this coming semester in our college program that is partnered with the Veterinary Business Management Association, speak at all of the vet schools in the U.S., is talking about just that. How do we think about providing more care, increasing access to care without raising prices being the only option, the way that we do that? So how do we provide methods of delegation and really let our technical staff work to the full amount of their license, delegate, knowing you have to have some technicians to be able to do that, which is certainly a challenge right now. But everything from delegation to just working a little bit more efficiently is kind of some of the things that we're talking about as well.
So it seems like it's kind of a long-term type of vision, but you got to start somewhere.
We do, and we know that we certainly can't do it alone. Everyone We're seeing some great ideas across the profession as we try and think about how do we increase access to care, knowing that we have some challenges with workforce, that we have some challenges with, right now, already, about 50% of U.S.-owned cats and dogs are not seeing a veterinarian on an annual basis.
I would believe that. It's a staggering statistic.
It's a staggering statistic. For the cat lovers like myself, it is a little bit more heavily focused on cats.
Sure.
It's about a little over 30% of that are cats. But knowing that's the case, and knowing that, I think most of us can agree that we believe every pet deserves some amount of care, of vet care from us. How do we really think more creatively about providing more care to more pets, whether that's financial solutions or whether that's trying to work in new ways and think in new ways with our teams? We've got a lot to do.
We do. This is an exciting conversation, and I love the focus on creativity because, like you said, we want all of our patients to be able to get the care that they need. That's, taking care of our patients, taking care of their families is where a lot of the passion lies for us in this industry. So how do we get creative? How do we get our patients the care that they need and help eliminate some of those barriers for pet parents?
One of the things that we're doing at Nationwide is last summer we conducted some novel research. We partnered with Mind Genomics advisors, and we tried to say, okay, one of the challenges that we see is how can we be sure that we are really communicating in a pet family-centered way, and potentially how can we do that a little bit more efficiently than we do right now. And so the goal of that research was to say, can we help uncover what are the subconscious drivers behind why a pet family chooses the level of care that they do? So helping us in two main ways. How can we communicate to them in a way that they want to be communicated with? And then how do we, as vet healthcare teams, get there quickly and feel like we're on the same page as them all the way through? And that research was completed last summer. I think one of the most important things to keep in mind about it is that across all demographics that we looked at, so age, race and ethnicity, education level, income level, marital and family status, and gender identity, really those things did not help predict what a pet family was looking for when they come in to see us in the vet hospital. And so, we know that I think from experience, if you try and look at someone or look at some demographic information about them and make a judgment on what level of care they might provide, we're probably going to be wrong. Having that research allows us to say, okay, the demographics don't help. What does help? How do we understand what people are looking for? And again, get there a little bit more efficiently, make sure that we're all on the same page. The way that came out was we have 3 distinct different viewpoints that were identified. So the first one is probably pretty intuitive. We have people that are motivated by cost.
Sure.
The top, and so we've talked about pricing, we talked about some of the challenges, especially what's going on in our economy at the moment. It's helpful to just think about cost is in fact a driving factor for how people will make decisions for one of the 3 groups. And they're roughly in equal components.
Okay.
Interesting thing about that group though is that they really, really care what we think. They want to hear from us the skill of clinical empathy, that what they're doing is best for their pet. They don't want to feel judged by us. And sometimes we do. Sometimes they do feel judged by us. So that group wants to feel like they're giving their pet the best possible care, despite being unable or sometimes unwilling to fully commit financially to what we might wish that they would.
Sure. Don't write that conversation off and say, oh, I'm not going to give them my full attention and do all this because I'm not going to get anything done anyway.
It's a group that they really do want to provide care for their pet. They just want to understand what the value is behind it as well.
Okay, I think that seems like a very reasonable viewpoint.
Absolutely. I think the second group is fairly straightforward as well, and I would say I fit into this group many times myself. Someone who travels a fair amount for work is convenience, highly motivated by just how can I save time, how can I, whether it's medications like a long-acting ear medication for an ear infection versus having to, apply topical medications at home, or whether that's the injectable in the hospital instead of tablets at home. Like, those are the kinds of things that help a convenience-motivated pet family to choose what you're recommending.
Did you find any particular communication styles that worked best for people who were motivated by convenience? Like you said, the people who cost is the main motivating factor still want that good communication. They want to feel like they are good, making good choices for their pet. Did you find anything similar with the convenience motivated group?
Yeah, they really want to understand the trade-offs between time, convenience, and cost.
Okay.
They are willing to pay more if you can display to them how it might be a little bit more convenient, whether that's a drop-off appointment or something else. They just want to have that conveyed to them, which makes sense, I think, as well.
Absolutely.
There are trade-offs in everything, and
Yeah.
that's the one that matters to them.
Sure.
The third group is really interesting from my perspective because they are interested in hearing all the options. They want to be sure they know, especially this group is motivated by evidence-based medicine more than the other two, what are the options and what's the support behind that to get us to the other side. What's really interesting about them to me is that they're more likely to choose a intermediate to advanced level of care as long as they know what their options are, but trust is lost with this group of people if we don't tell them what their options are from the beginning. If they have to Google to find out or find out from a friend, they lose faith in us as their vet healthcare team. What also is fairly interesting about this group is that they were fairly likely to choose an advanced level of care, but they really wanted to stay with their general practitioner if they could. So that bond was really close, as long as we continue to build that trust by making sure they understand what their options are.
And you said these three groups were split fairly evenly?
They are, yeah. Almost perfectly, 1/3, 1/3, 1/3.
That is interesting.
It is, and what I think is important for us to understand as vet healthcare team members is we might put ourselves into one of those. So I know for me, convenience is probably fairly high up, and the optionality is an understanding the evidence-based medicine as applied scientists. We all, I think, can identify with different pieces in these groups. The message that resonated across all of them was that they wanted to provide the best possible care for their pet. We describe those as pretty different ways of doing that. So it means something really different to those three groups, but they all felt like they were providing the best care to their pet.
I feel like the information seems very intuitive. Now the three groups and your description of that, I don't think was something I would have had top of mind. Like that's really interesting. But when you describe it, it makes a lot of sense. But the fact that the underlying motivation and what everybody wants to feel like at the end is that they provided the best care for their pet. They're just doing it in different ways. Yeah. It's so simple, but it's so complicated at the same time.
Yeah, it makes sense to me from an exam room setting. Like I feel like they make sense to me. To your point, it feels intuitive, but at the same time, it's not always how we think. We can feel judgmental if we maybe are interacting with a pet family that doesn't see things the way that we do.
Sure.
It can feel like we're judging them for the choices that they do make. I will say one thing that was not intuitive, well, maybe it is if we think about ourselves on the pet family side, as opposed to us, but as a pet owner, the thing that completely did not resonate with any of them, that they were very frustrated by, was a message, any message that talked about the most expensive option first.
Which is kind of in direct opposition to what many of us are taught.
It's so true. Most of us in communications training, and whether that's in school or afterwards, are taught that we should recommend the advanced level option first and then go from there, or in some cases the advanced level option first and then nothing, and then wait to see what happens from that.
Yeah, I've definitely heard that messaging before.
Yeah, I think from a pet owner perspective, they can sometimes feel like we are pushing them to make a decision that they may or may not want to make. And I think there's some really compelling research in human medicine that more so in human health than veterinary right now, that the first option presented has a lot of different cognitive biases associated with it. And so really it makes me feel like our responsibility is to incorporate that pet family's goals, their values, the level of care they're looking for, and their financial capabilities into what is that first option that we're recommending with it.
That's really interesting, because that's really, different from what we learned in the past. So it's, I'm glad this research is being conducted to understand how our message is landing and how we can, ultimately the goal is to do a better job communicating and help remove some of these barriers to pet care.
That's our goal. We have some work to do. We're excited about launching a tool later this year to kind of help get that research into the hands of healthcare teams. But we do think it'll be just helpful for making sure we're all on the same page and hopefully getting there a little bit quicker and easier.
All right, so if most clients aren't expecting gold standard care, that's not necessarily what they want, they're averse to having that most expensive option offered first, can you talk about some recommendations for effective communication to still offer all of the options, but help do that in a way that's maybe received a little bit better?
Yeah, I think the recommendation that we have, and that it's a published method as well, is to say, okay, how can we help understand what level of care they might want, and represent that option that we think might fit them based on their financial resources, based on what we've, people like me in emergency medicine learn from them very quickly about, their lifestyle and where the pet fits into the family, or in general practice, you usually have the ability to build that relationship over time,
right,
and
absolutely.
learn more about them. Kind of assimilate those things and say, hey, based on what's going on today, based on, we've just diagnosed your dog with a torn cruciate ligament. And because I know that you have a lot going on at home, and I know that you have, we have a strong bond here, and we have the ability to do surgery in our practice, I want to talk to you about all of the options. And the first thing that we're going to talk about is surgery here. And so surgery here with a lateral suture, and it would depend, of course, on the dog a little bit,
Sure,
with the evidence-based medicine pieces, but talking about we can have a great outcome with something like a lateral suture at a general practice. I want you to know what the other options are too. So one of the other options we could have would be to send you to see a board-certified surgeon, where they might talk to you about things like a TPLO or a TTA, so a different type of surgical treatment for this condition. And of course, including the cost associated with those, definitely
Sure.
different ones, but knowing that if someone is really busy, maybe they're convenience focused, or they're highly focused and want to stay here with me as a general practitioner, talking to them about what referral looks like too. It may be across town, or it may be an hour or more drive in some cases.
Yeah.
Then also saying, okay, if surgery is not something that we want to consider, I want you to know that actually basic treatment with crate rests, with pain medications, and with some rehab exercises that we can either teach you to do at home or refer you to somewhere for rehab, that's another option that you have that could avoid surgery. Some pet families really are anxious about putting their pets under anesthesia.
Yeah.
And there are some trade-offs in that. The pet family has to usually spend more time and effort, and it can be hard to create rest, of course. So patient selection is important too. But we have great evidence-based medicine that really both of those surgical options can lead to a fantastic outcome. Again, patient selection and included in that can lead to a fantastic outcome. And really the basic option can lead to a pretty good one too, just it takes a little bit longer to get there. So leaning on that evidence base, I think, helps us to feel comfortable recommending those different levels, and then just checking in after we offer those three options and saying, it sounded like maybe surgery here might be a good option for you, but after we've talked about all of them, what do you think? What questions do you have?
Right.
And at least having two check-ins. So we have kind of a 3-2-1 process. So those three options across the spectrum of care, at least two check-ins, making sure that you're on the same page about what you're recommending and what's right for them. And then the last one is really important too. That's one of recording things in the medical record. So
yes.
Really important that when we're offering any level of care that we document our conversations and we say, these are the pros and cons of the things that I offered, and that way we can feel comfortable offering across the full spectrum.
Absolutely, absolutely. It's really interesting. I feel like a lot of what I'm hearing is developing our communication skills as veterinarians and using our experiences that we've had in the exam rooms to help us understand what our clients and patients are asking of us. And doing that now with some of the data you've provided here, and that I'm assuming ongoing research will continue to provide,
Yeah.
doing that in an evidence-based way.
That's our goal. I think the piece that I want to make sure that we mention too is that really the whole veterinary healthcare team is part of this process, from the CSR checking people in to really a lot of these conversations around what's happening at home and really, budgets and the I have 4 kids that I'm juggling with extracurriculars. A lot of that conversation happens with our technical staff as well as they're gathering history. So really it's a whole team-based approach to that communication as well.
And now we're getting into empowerment and efficiency and all of that, which I would love to dive into and keep talking about. But I will not ask you any more questions for time's sake. But thank you so much. This is really interesting, and I can't wait to hear more and more as this data comes out and really helps us do a better job communicating with our clients and getting them what they need, getting our patients what they need. So thank you so much.
Thanks so much for having me.
And thank you to Nationwide for partnering with us for this edition of Vet2Vet. Check out NAVC's VetFolio.com for more of our V2V discussions on various topics in veterinary medicine. And remember, if one animal is better off because of you today, it's a great day.